Hi, Dr. Adam Miller here from Arise MD. Talking to you today about some justification behind why we think it's so important to test both the gut and neurotransmitters and stress hormones all up front to get a baseline on our patients who are seeking to improve their energy, to reduce stress, to optimize sleep, and to reduce irritable bowel symptoms. The gut, represented here, is in its action place is a small intestine that is like little villi, if you looked at it in surgery. And these villi are charged with sensing nutrients as they come by in the stool and drawing them out of the lumen of the gut and into the bloodstream. There's a lot of blood flow around the 25 feet of the small and large intestine because of this activity. The absorption of nutrients is a high energy. In fact, it takes 40% of your energy every day to make that happen. Where we get into trouble is when the single cell lining of that lumen breaks down and we get leaks of undigested food particles and bacteria into the bloodstream, causing a very low-grade form of sepsis. Now, the bacterial component that is so nefarious here is lipopolysaccharide, represented by LPS. And believe it or not, we now have the ability to draw blood from an individual patient and measure whether or not they have LPS circulating throughout their bloodstream, which you can imagine is a huge trigger for inflammation. The inflammatory markers that we're able to measure in the bloodstream include things like interleukin-1, IL-6, TNF-alpha, that's tumor necrosis factor, which is involved with breaking down tumors before they become too big of a deal for you. But the reason I bring that up is that if we have, and it's very common in our practice to see a little bit of intestinal permeability or leaky gut, if that's present, we very often will see an increase in inflammatory markers. And really what that is just a signal to the whole body that something's on fire, that there needs to be a reaction, that the immune system needs to stay turned on. And over time, that constant signaling from the immune system leads to an increase in the stress hormone called cortisol. And over time, cortisol will increase the amount of gut permeability. Now, you also get cortisol from stress, the perception of stress based on external events that are happening in your life at a given moment. And when cortisol goes up, we see a increase in the immune response. We see increase in leaky gut. We also see a shift in the microbiome. These bacteria, the 500 species of bacteria that are represented by the red and the blue circles here, we see a shift in some of the patterns of the microbiome. For instance, we see a decrease in bifidobacter, we see a decrease in lactobacillus, we see an increase in enterococcus. And those shifts, believe it or not, in the gut biome contribute to anxiety, fatigue, and memory issues. We know specific bacteria in the gut, like Bifidobacter infantis, increase the production of serotonin, that feel-good neurotransmitter that gives you a sense that life is okay. Bifidobacter infantis also contributes to barrier repair if you have leaky gut. Lactobacillus casei is in higher numbers known to help reduce anxiety in people, as is Lactobacillus rhamnosus GG. So if you're asking yourself, well, gosh, can't I just get a probiotic with those beneficial organisms in it if I'm having anxiety? And the answer is yes. We're now in an era where we can start to reach for these specific bacteria. Depending on your particular biome and your genetic makeup, you may need 30 billion a day, you may need 350 billion a day or more. It really is different from one individual to the next. But you can start to see then this close interplay between your mood, how you're perceiving the events of your life, the stress response system or the adrenals production of cortisol, and then gut fitness, whether or not you have leaky gut present what bacteria in your microbiome are there and which are deficient, and then whether or not you have, represented by these black dots, chronic high immune system reactivity emanating from the gut, where 70% of the immune system is known to reside. Those measurements, leaky gut, which bacteria are present, and how much inflammation is around your gut, show up in that GI map test. Based on which bacteria are present, we would know whether or not the gut is playing a role in low serotonin levels in your neurotransmitter testing. And then the presence of chronically high cortisol or adrenal fatigue would help us understand whether or not, in order to fix your gut, you really need to fix your stress response system. So we're talking about the stress response system in cortisol, which DHEA is also included in there, the neurotransmitters like serotonin and GABA, and the gut components. One of the things to keep in mind is that when the stress response system is chronically on overdrive and you're producing a lot of cortisol, adrenaline, and DHEA, one of the things that the nervous system does here up in the higher centers to buffer itself against the damaging effects of chronically high cortisol is to produce GABA and serotonin, these inhibitory neurotransmitters, to help protect the brain against cortisol. We know that after 30 minutes of high cortisol, you start to plaque arteries with high calcium. You get confusion of T lymphocytes, putting you at higher risk for infection and cancers. And you get swelling of the hippocampus, the memory center that puts you at a higher risk for Alzheimer's dementia. So cortisol over time can be very, very damaging. Well, if we see really low neurotransmitters, especially GABA and serotonin here, and we see high cortisol, and we see a little bit of leaky gut, we're probably going to start in terms of therapy here with a little bit of support here. I hope this helps you understand why we think it's so important to do a GI map test and do the neuro lab testing in saliva and urine that has both neurotransmitters and your stress profile, so that we can best understand where and how to get you as healthy as possible, rather than taking a shotgun approach and wasting time and money. You know, it's hard to walk away from a discussion like this without really respecting the microbiome and all that it does for your body, including turning on the higher brain, helping you with focus, avoiding ADHD, helping you with your memory. The bugs in your gut also help make vitamins like B12 and vitamin K2. They help produce neurotransmitters, as we discussed, and they even influence the enteric nervous system. Your gut has its own nervous system, which is why we sometimes refer to it as the second brain. And the bacteria communicate directly with those nerve fibers as they project up into the gut lumen to not only improve or influence motility or peristalsis, the pushing of stool and waste out of the body, but also influencing these nerves' ability to sense the micronutrients as they pass by the small intestine, to absorb the amino acids, to absorb the vitamins, and absorb the minerals and the fatty acids needed to support your cells so they can generate energy. It's a very sophisticated, beautifully designed system, and we have the ability to assess it like never before through some of the modern specialty testing. If you have any questions about the testing, or you just want to get started, you can email info@arisemd.com. Also, I would encourage you to look at our store at arisemd.com, because you can actually order this testing without a consult with me. We recommend that you have at least a 15-minute phone call with me to run through your history and make sure that this truly is the best way to start for you. But if you want to just get going today, go to arisemd.com, our store, and purchase the GI map test and the neuro lab test, and give yourself that diagnostic dashboard so you understand the true state of affairs under the hood, so to speak, for your gut, for your stress response system, and even your neurotransmitters. I'm Dr. Adam Miller from Arise MD. I hope this video is helpful for you.